All right, thank you, Kate. Now let's talk a bit of wellness now. As we get older, it seems we need to pay more attention to what we eat, how much we exercise, and how we take care of ourselves. In fact, listen to this. More than 40% of Americans over the age of 40 have something called metabolic syndrome. This is a condition which puts you at significantly increased risk of diabetes and heart disease. And here to explain and show us how we can actually reverse this condition is our friend Dr. Dane Donahue. So you're sitting at home, you're in this category over the age of 40, and you hear about this metabolic syndrome. Of course, you kind of get concerned, but what is it and how do you know if you have it?
Well, you know, it's a really important topic, and most people probably never heard of metabolic syndrome yet. 40% of Americans over 40 have it. And so metabolic syndrome is a condition that puts you at significantly increased risk for heart disease and diabetes. As a matter of fact, the Journal of the AMA showed that if you have metabolic syndrome, your chances of all-cause mortality, death from all causes, goes up significantly. So it's very important that we know if we have this.
And so how do you diagnose it?
So there's basically 5 criteria. If you have 3 of these 5 criteria, you have metabolic syndrome. And they are triglycerides over 150. If you have an HDL cholesterol that's under, the good cholesterol, under 40 for a male or under 50 for a female, your blood pressure over 135 over 85, also your glucose fasting if it's over 100, and then the last criteria is your overall conditioning, your BMI.
And of course, you have an 8-week program that a person can use to reverse this, and you even have proof of it. Let's talk about Miriam, who's one of your patients that you've worked with, and how it's, this program has actually benefited her.
Sure. So we have 2 patients here that we've treated with metabolic syndrome, and again, it's a very prevalent syndrome. Miriam did exceptionally well. You can see in her before and afters that she significantly changed her BMI, her glucose. She was a full-blown diabetic, didn't know it, and she went on this program. She did just phenomenal. Reversing diabetes, reversing a heart disease that she had, getting off some medications. So, and all of this with lifestyle change. It wasn't like we put her on more medications. We actually got her off medications.
And then there's Mike.
And
Talk to us about Mike.
Mike was phenomenal. He lost 7 inches of body fat. And what people need to know is metabolic syndrome is classified by having a large belly, having too much hanging over your waistline. So that's a lifestyle issue. So Mike reversed his diabetes. He was on 8 prescription medications, count them 8, in his early 50s. He's now on 2. He did the 8 Weeks to Wellness program. So these are conditions, these are lifestyle conditions that more and more people are going on medications for. And to be quite honest, they need to take a look at what they're eating, how they're exercising, how they're managing stress. Because if 40% of people over 40 have metabolic syndrome, they need to know if they had this. And the fact of the matter is they may not have symptoms, but certainly they may have the syndrome.
All right, Dr. Dane Donahue, thanks for stopping by and talking to us about this. Now, for more information on Dr. Dane's 8 Weeks to Wellness program, just go to cbsphilly.com and click on Talk Philly. Everything is there that you need. We'll be right back.